Speaker is from CELLCURE Neurosciences.
Hello, my name is Avi Ben Shabbat. I'm the medical monitor of CELLCURE's Neurosciences, and I'll present a brief update of our study aimed to treat dry AMD and geographic atrophy using a cell therapy called OpRegen. CELLCURE is an Israeli company located in Jerusalem, and it's part of Lineage Cell Therapeutics, which is an American company. The trial was conducted in 9 sites, 3 of them in Israel, Hadassah, Sourasky, and Rabin, and the other 6 sites are in the US. In 2022, Genentech and Lineage signed an alliance for collaboration for the purpose of conducting the next phase of the study, which is currently being conducted in the US, but we intend to bring it to Israel to include the Israeli sites again. So what is OpRegen? OpRegen is a cell therapy, a suspension of RPE cells derived from human embryonic stem cells. The treatment is focused on administration of OpRegen subretinal in the GA area, targeted to replace the damaged RPE cells in order to prevent the photoreceptor degeneration. It's an open-label, single-arm, multi-center dose escalation trial, and it included 24 patients. All 24 patients reached the primary endpoint of 1 year, and they are currently under long-term follow-up period. The first 3 cohorts included 12 patients, all with an advanced stages of AMD. They were legally blind with a large GA area. Cohort 4 included 12 patients in an earlier stage of the disease with impaired vision and smaller GA area. All patients received short-term perioperative immunosuppression, and the study had mainly 2 modes of delivery to the subretinal area. Direct mode with vitrectomy and retinotomy used in 17 patients, and suprachoroidal route, which was discussed earlier just now, using a special cannula designed by Orbit SDA specifically for subretinal delivery, which was used in 7 patients. In both cases, the injection includes a subretinal bleb, which is usually absorbed within few days. Blebs generally targeted the transition zone outside the GA, but 5 of 12 cases in cohort 4 included extensive bleb coverage that covered the entire GA area. This offered an opportunity to compare with 7 of 12 cases in cohort 4 with limited bleb coverage of the GA. What we saw is that an extensive bleb coverage has better outcomes than the limited coverage. We saw greater BCVA gain with mean gain of 12.8 letters at 12 months among patients with extensive bleb coverage when compared to the patients with limited bleb coverage. And what about anatomical and structural outcomes of the retina? So the outer retinal structure was analyzed using an eye-noted OCT segmentation algorithm with review and correction by a mask reader. The RPEDC, RPE drusen complex, to evaluate for any potential OpRegen engraftment, and the ELM, useful in defining the borders of the GA to evaluate for outer retinal structural improvement or worsening, were both selected for quantitative analysis. The RPEDC and the ELM area maps were generated for baseline and 12 months for cohort 4 study and the fellow eye. Shown here are the RPEDC and ELM maps at baseline and 12 months for case 4. At 12 months, the area where RPE is absent is smaller, and the area of ELM loss is also smaller. Here are the results for all patients in cohort 4. Area of RPE changes and area for ELM changes are shown for study eyes with extensive versus limited bleb coverage, with fellow eyes also shown here. There was a gain in the RPE area in study eyes with extensive bleb coverage as compared with stability or loss in the eyes with limited coverage in the fellow eye. There was also an overall stability of ELM area in the study eyes with extensive bleb coverage as compared with the loss in the limited bleb coverage for the fellow eye. The assessment was a quantitative assessment, and it was performed to see how early such improvement in the retina structure could be observed in the 5 cases with the extensive bleb coverage of the GA. The structural improvement was assessed by using the criteria listed here, and all 5 cases were assessed to have structural improvement by at least 2 of 3 reviewers. Onset of structural improvement was visible within 3 months in all 5 patients with extensive OpRegen bleb coverage. The outer retinal structure at baseline was assessed and compared with the structure at early postoperative time point between 1 day and 3 months. The time of the onset of the structural improvement was variable, ranging from 1 day to 3 months, and structural improvement was only observed within the GA coverage area of the bleb. This concludes that the following subretinal administration of OpRegen in phase 1-2 study, all patients with extensive bleb delivery to the GA showed improvement in the outer retinal structure on quantitative assessment. This suggests that anatomical improvement correlates with greater gain in the BCVA and was detected within 3 months of administration, while suggesting that extensive OpRegen bleb coverage may be required and be important to optimize patients' outcome. And this data suggests also that OpRegen RPE cells may counteract RPE cells dysfunction and loss in GA by providing support to the remaining retinal cells within the atrophic area. Thank you very much. Nice to see you.